Hi, it's Dr Kiran Kandola. Just had quite a number of questions recently about platelet-rich plasma, or PRP as it's also known, which is an excellent skin booster. So I thought I'd start with the most commonly of all those questions, which is what is it? Well, platelet-rich plasma, or PRP, is utilised by not only aesthetic doctors, but also sports medicine doctors, physiotherapists, and orthopaedic surgeons. And the reason for that is that what we do is we take your own blood and distill it into two fractions, one of which is red cells and the other of which is the plasma. Now within that plasma, we've got a fraction of cells which are platelet rich and a fraction of cells which are platelet poor. So what we do is we ignore the platelet poor, we get rid of the red cells, and we're left with the platelet rich plasma, which is straw coloured, of your own blood, so no other kind of chemicals involved. Now, why is that important? The reason is that platelets have got growth factors upon them, and those growth factors get activated by being in the presence of collagen and other tissue factors within your own skin, or anyone's own skin, or indeed tendons or ligaments. So, specifically for skin, if we concentrate on that and ignore the tendons and ligaments aspect of it, platelet-rich plasma is great for increasing the turnover of your own cells. So if it's popped into your skin, what happens is the fibroblasts increase their cell turnover, and that means that they start producing more collagen, and collagen is the thing that gives us our nice elasticity in the skin. So if you have platelet-rich plasma from your own blood injected into your own skin, your skin then reacts over the course of around 1 or 2 months to tighten and just look slightly thicker and with more vitality and glow. And of interest, the reason that orthopaedic surgeons, physiotherapists, and even vascular surgeons actually utilise PRP is the same increase in turnover of the skin or tendon. So they inject it into a joint which is unwell or a wound which has taken ages to heal, and the PRP sort of speeds up that process. So it's well known to work. It's backed up by scientific evidence. And it's your own stuff. So if you're concerned, as some people may well be, about chemicals being popped into their body, then PRP is a great alternative. So the second question was, what can it do for me? Was it? I know it's used for all these things, and you say it's good for the skin, but specifically, when would I use it? Well, it's excellent just for total facial boosting, if you like, skin boosting. So that would be to increase the glowing nature of one's skin as well as to increase the elasticity. It's also used in combination with either dermal fillers or threads to boost the skin's reaction to having both those treatments. Um, and another quite interesting way of using it is with micro threads. So that's when you have these potentially fine lines down here, is to put micro threads at 90 degrees to them and also pop in some PRP at the same time. So you get that boost to the skin cell turnover. Another thing it's good for, believe it or not, is hair growth. So most of the time you're thinking, well, I don't want much hair, thanks very much. I want to look nice and glowing and youthful. Well, it's actually on your head. So it's really good for supporting people that have had a hair transplant. So it increases the uptake of the skin cells with the hair follicle, prevents rejection and death of the hair follicle if you've had a hair transplant. It's also really good for staving off loss of existing hair. So it's not a hair booster, you won't grow more hair, it's just it will stop you either losing those that you have or really help with the uptake of the hair follicle transfer that you may have had. Another thing it's really good for, PRP, is under the eyes. So if you have dark circles or slightly thinning skin there, the PRP treatment can be excellent for decreasing that. So let's talk about how you get this done. So most people opt to have a course of 2 or 3 treatments. You can try one to see what improvement you get with that, but for the most optimal results, I tend to recommend 2 or 3 treatments spread apart by 4 to 6 weeks. Each treatment costs £400. So if you have a standalone treatment, it's £400. And then if you book in for 2 or more treatments, they're £300 each. In terms of results, you're kind of looking at after the initial downtime of maybe a day or two with potential for slight bruising, You're looking for improvements that will be evident after 4 to 6 weeks. So aftercare for this, I would advise, if you've got any bruising, which may be slight blushing, to use something like arnica or arnica cream to help the minimisation of any bruising. In terms of discomfort at the time of the procedure, it's very, very minimal because we'll use topical numbing cream, which usually is enough to not even feel what's going on. And afterwards, any discomfort is very minimal and goes away after half a day or so. So after the procedure, there's potential for slight bruising that will last for a day or two, and during the procedure you'll be nice and comfortable because we use topical numbing cream. The further aftercare in detail will be provided on the day of treatment. So thanks for watching the video. Taking the time is really appreciated. If you liked this video, you can like the video. If you loved it, you can subscribe, and all my socials are up here. If you wanted to book in for a consultation, please leave a comment below. Contact me via my webpage or Facebook or even Instagram, and I'll get back to you. Thanks very much.